Gives me a great pleasure to introduce Dr. Sweeny Johal, who's going to deliver the next talk. Sweeny is a consultant gastroenterologist at the Sheffield Teaching Hospitals Trust. In addition to advanced endoscopy, mindfulness is one of his interests, and he's going to tell us a little bit about mindfulness. So over to you, Sweeny.
We are all time travelers, traveling into the past, reliving memories of things happened a long time ago. Often there's recall bias. We remember things that didn't go particularly well, all those datexes and series, I suppose. Or we travel into the future, imagining how life might turn out to be. This moment seems to be an issue for us. It seems to be getting in the way of our happiness while we wait for something bigger, better, brighter to come along. The problem is, if you look at studies, the amount of suffering you experience in life directly correlates with how much mind traveling you do. The medical term for this is chronesthesia. I've never counted how many thoughts I have in a day, but it's estimated we have up to 80,000 thoughts. Thoughts aren't bad in themselves until you realize that about 95% of thoughts are repetitive. They're the same old thoughts over and over again. And 8% of these thoughts tend to be very negative. Sometimes the worst place you can be is trapped in your own mind with all these thousands of negative thoughts. I realized a while ago that patients of mine, the ones that were preoccupied with the past, were quite depressed and down. And those very preoccupied with the future were very anxious and worriers, basically. Those people here, in the present moment, seem to enjoy the best quality of life. If you like, the eye of the storm, the oasis in the desert. But it was not always like this. This mind traveling seems to start at the age of about 7. Our happiness seems to be projected into the future. If you get certain qualifications, get a degree, a job, a partner, 2.4 kids, build up a nice pension, retire, maybe, then you might be happy. It's probably the biggest addiction facing mankind, compulsive thinking. It's there on tap. We can do it any time we want. Me time becomes a thing of the past. As you go through life, you have more and more things to do. Multitasking becomes a norm. And rather than focusing on what you're doing now, you start to worry about the next thing or the thing after that. So everything you do starts to suffer because you're not fully focusing on that one thing you can do now. The flight or fight mechanism kicks in. In prehistoric times, it was fantastic. Go out, get some food, get back to the cave. But these days, we start to imagine all kinds of danger when we're perfectly safe. The mind can just literally run away with itself. If you think this does not apply to me, the body will tell you the truth. It is a perfect mirror image of what's happening in your mind. If you can't sleep at night, if you get fatigued, if you get muscle ache, it may not just be post-COVID. It's probably your mind isn't settled. We've all got busy lives. We can get fatigued, we're running around, we can get burnt out. When things get too much, you can reach for unhealthy solutions. Drinking too much, taking drugs, self-harming. But I say, don't do that. What about a prescription of mindfulness instead? Try that, much healthier. But what is mindfulness? Mindfulness is about present moment awareness, non-judgmentally accepting your feelings, thoughts, and bodily sensations. Why? Because they're already here and they're arising, you can't stop. So what is a mind-based cognitive therapy program? Normally, it's done over about 6 to 8 weeks, and you learn various techniques such as the breath scan. Your mind can only do one thing at a time, so if you focus on your breathing, it can be very, very relaxing. The body scan, you kind of drop your awareness into your feet, then maybe your legs, and you'll work your way up to your head, or you can work the other way down. Mindful movement, Listening is an active process. So rather than listening to what's playing out in your head, listen to what's around you instead. And befriending is very important. It doesn't matter what thoughts you have. They're just thoughts. They'll come and go. The mind scan is very, very important technique to have. So rather than being in the traffic trying to dodge all these thousands of negative thoughts, it's a bit like standing on the sidewalk and watching the thoughts go by. It's a very useful technique to have in life. Mindfulness is basically using your senses to root yourself in the present moment. Listening to what's around you, watching what's around you, rather than what's playing out in your head. So it's getting out of the automatic pilot mode and regaining your life back. Why not practice with daily tasks? See how far you can walk before you have a thought. Can you eat a meal without compulsively thinking? Maybe practice just brushing your teeth in the morning. Just give yourself a break from overthinking. Your problems will still be there by the time you finish brushing your teeth. So what about the evidence for mind-based therapy? Well, there are now thousands of studies. And what amazed me when I first started looking at this was something called neuroplasticity. Your brain structurally starts to change literally within weeks of practicing mind-based therapy. So if you like, in the simplest terms, the brakes to overthinking, like the prefrontal cortex, get stronger, and the worry and war machinery start to dampen down. And the more you practice, the more changes you get. So this is probably the key slide. Can you switch gears? The doing mode is very good for practical things. If you need to drive from here to back home, fantastic. It's excellent at these kinds of tasks. The problem is if you start to use a doing mode for things it was not designed for, like figuring out your emotions or why things happened in the past, it's not good for that at all. In modern day life, we are bombarded by so much information. It's like reading 124 newspapers per day. It can be very tiring, can be very exhausting, just staying in the doing mode. Why not learn to switch gears to the being mode, engaging with life as it unfolds, moment by moment? The being mode is very replenishing. It's able to sit there and enjoy that beautiful sunset without worrying about what you have to make for tea. If you take time away from the mind, it goes nowhere. It's like pumping petrol out of a car. It just stands still. Time is the issue. So there's loads of research with regards to the benefits of mindfulness. We talked about structural changes in the brain. It helps you reinforce your boundaries, helps you say no to when people ask you to do more than they should. The telomeres, if you look at your telomeres, they are longer in people who are more mindful. Studies have shown that you can age by up to 10 years by worrying. This study was done in 20 to 40-year-olds. You have the best relationships if you are more mindful, not just with yourself, but with your friends and your family as well. As long as you have dysfunction within you, there'll be dysfunction in all your relationships. We know you have more bodily symptoms. If you want to succeed in academia and sports, focus on the process and the results will take care of themselves. If you look at, for example, depression, if you have a family of 4 people, one person statistically will have a mental health problem now, another person will develop a mental health problem. So half of us in this room will have some kind of psychiatric problem in our lifetime. I don't see psychiatric problems as problems. They're part of being human beings. We get down sometimes, we get anxious sometimes, and that's okay. If you look at mindfulness, in those patients with resistant depression, those patients who could not get off antidepressants, half were off antidepressants after a simple 6 to 8 week course on mindfulness. So I don't know, why do we don't teach these techniques to every man, woman and child at a very early age before problems start? I don't know if you ever heard about the 2-arrow analogy. In life, you're going to have some suffering. And that's the first arrow. The second arrow is much more deadly. It's an arrow that we hold in our own hands, and by repeatedly revisiting negative events in your life, you make that wound much, much, much deeper. So it's about moving from fear avoidance and disability to fear confrontation and recovery. And there's loads of different techniques for that as well. It's about being present, staying in the now, realizing who you truly are, that you're not simply just a body. You're not a mind either. These thoughts are not who you truly are. And also realizing that everything is temporary. Even your problems, what has a beginning, has an end. And accepting what you can change and what you can't change, and being at peace with it. So why not befriend this moment? Why not make this moment your constant companion in life? Because that's all you have. You can't actually go back into the past or the future. It's a choice. It's a 50-50 choice. Mind wander needlessly, or befriend this moment. When you've had enough suffering, I always say people will make the right choice. It's being able to sit there and enjoy that beautiful sunset without worrying about what your boss is going to say, your partner, your kids, what you have to cook for dinner, the laundry. So, to sum up, beware in the pursuit of happiness, constantly thinking that happiness will be found in the next place, the next moment, the next job, the next relationship, when I win the lottery. Until you give up the idea of happiness somewhere else, it will not be where you are.